Myocardial infarction. The myo means muscle, cardio means pertaining to the heart. Myocardial infarction is that tissue. Localized neurosis, localized death of cardiac muscle tissue, resulting from blockage or narrowing of the coronary artery supply in that area. And myocardial infarction is usually caused by formation of the thrombus, blood loss in a vessel. And the heart muscle cells is supplied by two coronary arteries, the left and the right coronary arteries, and the left coronary arteries supplying the blood for the left atrium and the left ventricle. The right coronary artery supplies blood for sinoatrial node, right atrium, and parts of left ventricle and right ventricle. So any blockage happening to the coronary artery can damage the heart wall, and myocardial infarction is a consequence of formation of thrombus in the coronary artery. And myocardial infarction is irreversible. That means we cannot correct neurosis of the cardiac muscle tissue, but we must intervene to save the life of the victims by administering robotics plus a medication to relieve the pain of the patient and to dissolve the blood loss inside the coronary arteries. The occlusion, a synonym of the occlusion is the obstruction. Occlusion of obstruction is of the vessel. Occlusion of the coronary arteries leading to a myocardial infarction. A loosening of the blood supply for the legs can lead into the gangrene of the legs. Patent ductus arteriosus. Ductus means channel. Arteriosus means artery, and patent means open. There is a present or existence of communication between the descending aorta with the pulmonary arteries. The patent ductus arteriosus exists in the fetal life to bypass the lungs in the fetal life, but at the time of giving birth, this communication closes due to the presence of high concentration of oxygen in the blood, and ductus arteriosus becomes sclerotic. So the persistence of the ductus arteriosus after birth is called the patent ductus arteriosus, and the ductus arteriosus is a vessel that connects pulmonary artery to the descending aorta in the fetus to bypass the lungs. In the fetus, the lungs does not work, and after giving birth, the baby neonates within and inflates the lungs and increase the concentration of oxygen in the blood and makes the patient's ductus arteriosus sclerotic. Phlebitis is a suffix meaning inflammation. Phlebo means a vein. Phlebitis is inflammation of the veins and forming blood loss. Black, what does it mean? The black is a patch. Another names of the black in cardiovascular system are thermometers. Black. When we consider regards to the cardiovascular system, deposits of fatty material or other substances on the vessel wall, and the situation impedes in the blood flow and blocking the vessel. The black is harmful for the blood flow, and thermometers black is black consisting of fatty material accumulating on the inner linings of the vessel wall. Rheumatic heart disease is a disease of valves damage the valves of the heart after infection with a Staphylococcus group A hemolytic Staphylococcus. And when the patient become infected with group A hemolytic Staphylococcus, the antibodies will be produced in response to infection, and these antibodies will produce valvular scarring. And the most common valve affected is mitral valve, and mitral stenosis, mitral regurgitation after rheumatic heart disease. Septal defect is a communication between two atria, two ventricles. So this is a communication between the right and left atria. Usually, there is a remnant of foramen ovale existing in the fetal life and after birth. And this foramen closes tightly, but if there is any reason for the foramen ovale persists, there will be a consistent communication between two upper chambers. Septal defect, an opening in the septum between atrial ventricles, and the common cause is a persistence of foramen ovale, opening between the atria, bypassing the lungs in fetal circulation. In fetal circulation, both lungs don't work until the baby is born, and when the baby inhales, the foramen ovale closes tightly. Shock. What is shock? Shock is a circulatory failure, and we have several kinds of shock. Cardiogenic shock. Cardiogenic shock. Shock comes from the heart. Cardiogenic shock is caused by the heart failure. Heart work is a pump. So when the heart cannot pump enough blood for the body, we have the cardiogenic shock. Hypovolemic shock happen in severe bleeding and caused by loss of blood volumes or diffuse sweating or diarrhea, and we have hypovolemic shock. And septic shock. Septic shock is caused by bacterial infection. It's result from the inadequate blood supply to the tissues. The shock is detrimental to the body. The stenosis is narrowing or stricture in a linear lattice of cardiovascular system. Mitral stenosis is a narrowing of mitral valves. There's stenosis, constriction or narrowing of an opening. It can happen at any meatus, any openings, or oral stenosis and constriction of the mouth. Anal stenosis, constriction or narrowing of the anus. Stroke. A stroke is another name of cerebrovascular accident. Syncope. Syncope is symptoms of nervous disease, heart disease. Can happen in many specialties. Syncope is a temporary loss of consciousness, and the cause is inadequate blood supply and blood flow to the brain. So syncope is fainting. The patient loses consciousness temporarily and recover after that. Tachycardia. This is a term opposite in meaning with bradycardia. Tachycardia. Tachy means fast, rapid. Cardia means the heart. Tachycardia is a situation in which the heart beats rapidly and the heart rate or heart rhythm is more than 100 beats per minute. Thrombophlebitis. There are two phenomena associated with these medical terms. Thrombo means blood loss. Level means veins and arteries. Surface means inflammation. Thrombophlebitis is inflammation of the vein associated with blood clot formation. So we can draw the meanings by analyzing the medical terms into these components to understand the meanings. Thrombosis is a disease. Thrombo means blood loss, and osis is an abnormal condition of the disease. So inside the patient, inside the body, there is a formation of many blood loss, and when the blood loss or the thrombus is a singular form, and rhombi plural forms. Rhombi can break loose or can dislodge and travel to the other areas and get obstructed and causing symptoms. A development of blood loss within the vessel is a thrombosis. Thrombus is a blood loss formed locally, and thrombus is different from embolus. Embolus is traveling thrombus, means it's the flow in the bloodstream to the other area. So thrombus, blood clot, forming within the blood vessel, and thrombus, root, thrombolysis, thrombitis. We can use thrombus root to form many medical terminology in cardiovascular system. Varicose vein is dilatation of the vein, and commonly occur in the legs because of the force of gravity. Varicose veins, very twisted and swollen veins resulting from breakdown of valves, pooling of blood, and chronic dilatation of vessel. And we also call the varicose veins varus varicosity. This is a normal vein with a competent valves, preventing the blood flow effectively when the valves close. In varicose vein, the valve is incompetent, so there is a regurgitation or backflow of blood, flowing backwards and pulling the blood downstream the valve. When we examine the legs of the patient varicose veins, we can visualize clearly on the surface of the legs underneath the skin with swollen and twisted veins resulting from breakdown of valves.